Welcome to the Peaches and Cream Foundation podcast. I'm your host, Sahei Gayle, a business intern here at Peaches and Cream Foundation, a nonprofit organization that offers mentorship and provides support services and resources to children in need, and internship opportunities for college students. In this podcast, I'll be joined by fellow psych interns Giselle, who will share their insights and experiences as we explore various topics related to mental health. Before we begin, the Peaches and Cream interns are not licensed professionals, and we do not claim to provide professional help. This podcast is for educational purposes and to spread awareness of mental health. Intentions for this podcast are for educational needs. Welcome to the Peaches and Cream Foundation podcast, where we are dedicated to ending child poverty and being the voice for children. At Peaches and Cream Foundation, we believe that mental health is a cornerstone for overall well-being, especially for children and young adults. I'm Sahai, your host, and joining us today are Giselle and Hanah, our current psych interns who work to support our mission, along with a special guest.
Hello, everyone. I'm Giselle. I'm a psychology student at the University of Rochester and a psychology intern at Peaches and Cream. I'm very happy to tell you guys about our special guest today. Dr. Richfield is a clinical psychologist based in Plymouth Meeting, Pennsylvania, who specializes in children, teen, and adults who struggle with internalizing disorders such as anxiety, depression, ADHD, OCD, or ASD. He also works as a parent coach and is the author of The Parent Coach, which is a monthly parenting column established in 2003. He is also the creator of many psychoeducational tools, including the parenting coaching cards, the Dadditude App, which we will definitely dive into more later on.
Hi guys, I'm Hanah, and I'm also studying psychology at the University of Rochester, and I'm another psych intern at Peaches and Cream. Thank you for joining us at Peaches and Cream Foundation. We're really excited to be speaking with you today, so let's get started. We're just going to begin with some clarification questions for listeners. So the first question is, what is the difference between a counselor, a therapist, and a psychologist?
First, I want to thank you all for inviting me on, and I'm here to support your education as well. So please know that down the road, if you want to contact me with any questions, you now have my contact information. So let me begin with what is a psychologist, because that's what I am. That's a person that has received specialized instruction. And in Pennsylvania, you must have a doctoral degree. You must be trained by what's called an APA accredited program. That's the American Psychological Association. You must take a licensing exam. You must do continuing education. You must get supervised experience the run up to that exam, and you have specialized training in evaluating and providing diagnoses. That hasn't changed really since I was in graduate school in the early 80s. I graduated in 1986, so I've been out in the field for quite a long time. Since that time, they've introduced other licensure into Pennsylvania and across the country, I believe, that is called a professional license, LPC, a licensed professional counselor. And that's a person who has a master's degree, also has received, I believe, 3,000 hours of supervised experience, must take a licensing exam, but they're not allowed to call themselves psychologists. They don't do diagnoses and do psychoeducational evaluations like psychologists do, but they do treat a wide range of people with different disorders. They often refer to themselves as a licensed therapist. And a counselor is a more, I think, popular term to describe a host of different types of vocations. You could be a lactation counselor. You could be a juvenile probation counselor. So that's a term that is across all disciplines for the most part. You could be in HR and call yourself a counselor, a human relations. So it's not specific to mental health.
Thank you. Our next question is, who can prescribe medication and what qualifications are needed to prescribe medication to patients?
So in very rare instances, there are psychologists in very underserved rural areas who have to undergo very rigorous training and can receive prescription privileges. And they introduced this, I think, 5 to 10 years ago, just because there weren't enough psychiatrists who were prescribing medications for psychological disorders. I'd say that's a very small percentage of the folks in my field. The vast majority are either physicians who have just standard medical training, such as a family doctor. But if you want more specialized service, you'd go to a psychiatrist who also has an MD but took a residency in psychiatry. And I do not, by the way, prescribe medicine. I'm not one of those doctors who has undergone that training.
And our final clarification question is, why do some mental health professionals not focus on servicing children?
Well, that's an excellent question, which we could spend a whole time discussing. It really comes down to training. There are many programs in the country that do educate people to get their doctorate, earn their doctorate in psychology, but have insufficient training in working with children. There's a couple in our area, in fact, that are like that. The reasons are likely related to the politics of the university, the amount of people available like myself who want to train others in working with children. There's likely more liability that is introduced into the program when you're working with children. You have to have contact with parents when you're working with children. A lot of practitioners do not want to deal with parents, unfortunately. They just feel like that introduces a level of complexity. And also you have to deal with the school. You have to be in contact with the teacher. And, you have to have a more holistic approach than when you're working with an adult. When you see an adult, it's, comparatively less stressful for the mental health professional. I spend a lot of my time talking to parents. Or texting them or talking to their teachers during the school year. There's a lot of extra involvement that working with children requires of mental health professionals. And if you're going to go through a program that provides you with the expertise to do so, you're going to be taking 10 to 20 classes during your years in doctoral training. And you're going to be receiving practicum and internships, and a lot of programs just don't want to deal with that. So that as a result, you get out of your graduate program and you're not prepared to work with children. I'm sorry to say.
Okay, thank you for that clarification. And now we're just going to get into a couple of questions more about you and your work. So first and foremost, can you tell us about your background and what inspired you to become a psychologist?
Sure. Well, I got a very early head start in the field because when I was actually probably around the ages of you three, still an undergraduate student in psychology at George Washington University, GWU. I was majoring in psychology at the time because I just really enjoyed the classes and I was fascinated by what I was learning. But I didn't know I wanted to become a psychologist at that point because I was really alternating between going into law or psychology. So what I did is I went and I found a job working with a lawyer and quickly discovered this was not for me. I didn't really like the role. It was just too narrow for me and it wasn't relationship oriented. So I thought to myself, okay, well, let me try my other major, because I was dual majoring at the time. And I was lucky enough to land a job at an incredible psychiatric hospital in Rockville, Maryland, working with very severely disturbed people, schizophrenics, people with severe psychopathology. And that was really the crystallization of my decision to pursue psychology, because I just found it, very fulfilling to help people who were psychotic to begin to develop a relationship of trust with me. And I felt like I had a knack for it, actually, and was told that by my head nurse and a number of other people. I worked in their research facility. And so for a year and a half, I worked at Chestnut Lodge, which no longer exists, but it was a foremost psychiatric hospital around the turn of the century until it closed its doors probably about 15 years ago. So that was what crystallized my decision. Now, mind you, I don't work with that population any longer, but it still, in my mind, was the beginning of my trajectory.
That is very cool. What area of psychology do you specialize in, and what drew you to this field specifically?
Well, I was drawn to the field of working with children and teens because in my 5 years at Hahnemann, I spent more time working with children than any other population. They had excellent placements. I was there, my first year, I was working at a Head Start school called Irving Schwartz Institute, which used to be located on Monument Avenue near Belmont. In my third year, I was working at a early intervention preschool on Calla Street in Philadelphia called the Center for Early Childhood Services. In my fifth year, I was working in an outpatient psychiatry clinic at Aberdeen Hospital. And then in year 2 and 4, I was working with adults. So in those 3 out of 5 years, I had excellent supervision, people I'm still in contact with, 40 years later. And I felt very fulfilled in what I could offer. And I was also very struck by the troubles children had in their relationships with parents at that time, and how parents really often were so just struggling with their own, say, financial or societal barriers, that it really was difficult for them to provide soothing, proactive parenting. So all that really inspired my dissertation, which I wrote on actually fatherhood, which was a kind of a forerunner of my interest in fathers and dadditude. So a lot of these experiences is what cultivated why I got involved with children with ADHD, because I didn't feel that the conventional model that I was learning at school really did the trick for these kids. These kids are so often really just clueless, when it comes to their social relationships, when it comes to their emotional regulation. And the model that I was learning wasn't doing it as far as I was concerned. So I was inspired to develop my own model, which I call coaching, which blends psychoeducation, relationship building, and parent work. And that for the coaching cards grew out of that model. And I still use that to a great deal. So that's how I got involved with that population. And then that also led me to work with the population of people at the time who were called Asperger's syndrome. Now it's just a continuum of autism spectrum disorder. That's the bulk of my practice. But I now see many adults. In fact, the majority of my cases now are adults because I've been seeing them for so many years. They just, they grow up. They come and go out of my practice over the years.
Right. So tell us a bit about your work on the Dadditude app and an overview of the Dadditude app. And what made you want to focus on fathers specifically?
Well, I think it's because of the relationship I had with my own father, when I was younger. And, like a lot of men in my generation, children were to be seen and not heard. That's the umbrella that I was raised under. I didn't really buy into that. In my waiting room now, I have a poster that says children should be seen, heard, and believed. And, I was determined, really when I was even younger, to be different, when I was a dad. So I was really convinced that I wanted the opportunity. And what happened was, after my dissertation, which was on fatherhood, I went into the field. I got involved with a local group, a chapter of CHAD, which is Children and Adults with Attention Deficit Disorders, here out in the suburbs. I started doing some parent consultation work. I realized how fathers were so disengaged in the lives of their children with ADHD. So often they were really just taking orders or instructions from their moms or their wives, and the moms weren't always all that informed as well. I started writing a parenting column around 2000, early 2000s. Every month I'd write something different. A lot of these columns addressed fathers and mothers and how to work on evolving as a coach. Some of my favorite articles I wrote was Coaching Restraint to the Drill Sergeant Dad, because so often the dads were just acting like drill sergeants in their families, rather than, beacons of comfort and understanding and building trust with their children. And then, I had been writing this for, many years, and they're circulating all over the internet. And then during COVID, there was this businessman in Germany who contacted me, and he had this idea that he wanted to start this app for dads. He wasn't in mental health, but he had found me by, just searching articles on fatherhood. And that so often happens. And that's why we're talking this morning. People just locate me on LinkedIn, and my articles have been widely disseminated. So he wanted to know my thoughts and if I'd be willing to join forces with him, and I'd be his first content provider. And I said, sure. I had a lot of time on my hands. It was COVID. It was lockdown. And, I just took a lot of my prior writings and just sort of, pared it down for app use. There's a lot of original content too. So that's really how it got started. I wasn't really the guy who had the idea. I just provided all the content to Paul, who started the app.
Okay, thank you so much for telling us a bit about yourself and your work. And I just have a couple of more questions, a little more general. I would just wanted to know, as a psychologist who works with adolescents and young adults as well as children, what are some unique challenges you've noticed that people of this age face?
I think peer acceptance is a very stinging problem for so many of the kids and teens that I work with, because so many of them do have learning differences. They either have ADHD, they're dyslexic, they may have autism, and they really haven't been able to find a sense of belonging and develop effective interpersonal functioning. So along with their difficulties with emotional regulation, of course, which makes their social relationships all the more painful and sometimes rejecting. So that's probably the key element in what I address in my patient population of kids and teens. Along with academic underachievement. That's an issue too.
So to follow up with that question, in experience, what are some of the unique stressors that children in impoverished neighborhoods is and how do these stressors relate to each other for children that come from cultural background or minority status?
Well, I would envision that part of the problem is what is called a performance deficit, where sometimes they don't really understand both what appropriate behavior would be considered and what is expected, along with what would be considered just like a trouble with understanding the impact they have on others. That so often I would think that they're more inclined to think about today, the moment, to live in the moment, especially if they're living in hostile environments and they have to worry about, eating and safety and where their mom and dad is. I think that, again, it's the social component of their lives that probably is not top of mind. How am I going to grow into a well-rounded social being? So I would think that what would happen is once they leave that environment and say go to college, they may not be socially prepared for what they're going to be confronted by. Different cliques, different expectations, different judgments. They may not be prepared to manage the feelings that are going to get triggered in them, because they've been living in this impoverished bubble. And once they leave, it's going to feel like culture shock.
We're shifting gears a little bit now, but
Okay.
As someone who has worked as a mental health professional for over 30 years, how do you think the stigma surrounding mental health has changed over time? And what advice would you give to communities that are struggling to break this stigma?
Well, fortunately, I don't think it's as stigmatizing today as it was, say, when I first entered the field, which was in 1980. That was when I first started working at that hospital I aforementioned. The reason it's changed, I think, is probably twofold. One is so many celebrities have come out and are very open about discussing their mental health challenges. And they are very much models for the younger generation. Secondly, I think the advent of these online therapy services and the celebrities that are now, sort of being paid to advertise them also has, along with the social media component, made this much more normative. Because I'm sure, not that I spend any time on TikTok, but people, I'm sure, talk about their ADHD or their OCD. I'm told this by my patients, that there are people who espouse to be experts, because they've got it and here's what works for them and, that type of thing. So I imagine that that's one positive of social media. But I'm sure that it's still stigmatizing for a lot of people to come in and get help. I mean, I know that because I see, boys, right now in high school, very reluctant, they want to make sure that they don't spend a lot of time outside my office. They want to walk right in. They don't want to be seen, so, it still exists. And, I think in terms of answering your question, Hanah, I think what can communities do? I think, in the case of, say, my coaching cards, for instance, when they've been introduced in schools or agencies over the last 25 years, a lot of times they're repackaged as leadership cards, okay? They're not really designed for mental health. They're designed to boost your leadership qualities. So I think one thing communities can do is they can run groups that aren't considered mental health groups, but they can call them something else. A lot of times it's the label that really turns kids and parents off. I mean, I could just follow up from that. Years ago, when there was a grant available to run groups in schools around the suburban Philadelphia area, they didn't call them coaching groups. They I think they called them social IQ groups or something like that. Again, only on something that the parents will more easily digest.
So for communities that don't have access to clinical practices, are there any books, tools, or resources that you would recommend for those seeking to improve their mental health?
Well, for starters, there's these. These are my parent coaching cards. And these are available. Certainly, I'd be willing to, donate some sets. They do require, though, that there be a person like one of you or all three of you available to train some of the parents in how to implement the system. Each one of these cards addresses a social and emotional challenge of children, teenagers, even young adults. And it's all based upon the concept of emotional and social intelligence, but it's just watered down for easy consumption. Each one features a front, like this one, which is for verbal impulsivity control, and then on the back, cognitive behavioral self-instruction. But there needs to be a sensitivity to the child, to the parent. Although you really don't need the parent if you're a therapist or even a psychology intern working with these children. The other thing I use, because I am a strong believer, as you can imagine, in psychoeducation, is there's a series of books called What to Do When. I actually pulled 4 of them out. Like, for instance, this one is What to Do When Your Temper Flares, What to Do When You Grumble Too Much, What to Do When You Worry Too Much, and What to Do When Your Brain Gets Stuck, for kids who are more OCD. So I'll often assign chapters as part of my work in therapy. So I think, to answer your question, one thing that would be really helpful would be to introduce group psychoeducational resources into underserved populations. And to that end, I did write a curriculum years ago to run groups using both my coaching cards and other games that I've developed by a trained therapist.
So to follow up with that question, in addition to like your coaching cards and your books, are there other ways like friends and family members can support their children who are struggling with their mental health, or any other resources you would recommend?
Well, of course, children often are trying to express themselves through their behaviors. And oftentimes, unfortunately, parents will respond to the behavior, not the feeling that's behind the behavior. I call it the source. In other words, the way I explain it to parents is there's the surface expression of the feeling, which is what most parents respond to. For instance, they're being disrespectful to me. And then there's the source of the behavior, which oftentimes is, say, shame or embarrassment. And the parent is not at all mindful of what is motivating the surface behavior. And so the child feels very misunderstood because the parent just dishes out a consequence. They act like what I call a parent cop, basically pulling the kid over and sentencing them to no electronics for a week or whatever, versus huddling up and talking it over privately about, what's going on, and finding their coaching voice. And all this is in my book. I wrote a book about the whole model too years ago. It's called All Things the Parent Coach. And so it describes how to do it as a parent. And the key is to build trust and to listen, not just scold and lecture, which doesn't come naturally to a lot of parents. Again, I could go on and on, but those elements are sometimes the basic ones that parents have to hear, and then as a therapist, you watch and see how the parent responds, because some of them, it's just very difficult for them to assimilate the idea that if a child's acting disrespectfully, you go over and you have a private conversation with them and hear them out. Their knee-jerk response is just to punish them. That's the first step towards helping a parent become a coach.
Yeah, another problem that we wanted to address is that oftentimes people have to pay out of pocket for mental health services, as their insurance companies may not cover their treatments. So what do you think can be done to address and provide more mental health resources for youth and people as a whole who may not have access to therapy?
Well, certainly there are these community mental health centers throughout, the country, throughout our region, and they do provide sliding fee. And I've worked in many of them. Most recently, I worked in Roxborough when I was a grad student at Interact, which is a wonderful community health center. And so you can get services for free. I mean, if you meet income limits. But I think the problem really is that the waiting times are ridiculous. Okay. And you probably can't get in and provide and get the necessary services, which is usually at least weekly. Sometimes they can only see a child or a parent-child every other week or once a month. It just is inadequate, is what I'm saying. So, it would be wonderful if there were grants that could build the kind of, optimal and optimized mental health delivery systems for children and adolescents. If we could just, prioritize that for our future and for, of course, the present circumstances, especially, with how COVID has impacted upon the social and emotional development of children. It's been pretty serious in terms of their mental health challenges. So grants, I think, is really what it comes down to, is applying for grants. And there are plenty of agencies in our area who have the money for that. I just recently actually reached out to one. I was offering to actually donate my time and the coaching cards, and I haven't received a response. Pretty remarkable. Not going to name the agency.
As someone who has been very established in your field and you have so many tools and resources that you created, what advice would you give to the Peaches and Cream Foundation, or more specifically, our mental wellness initiative, to get people involved with the mental wellness movement?
You mean to get people like yourselves interested, or to get clients to embrace getting help?
More so the clients.
Food. I think if you feed people, that really attracts them. When I was running groups years ago, that really helped. I had groups of children and they were eager to sign up. The other aspect of it would be animals, food and animals. Okay. So I would have my Sheltie with me while they were having pizza Sometimes Rocky would take a bite. Now I have Cody, his cousin. So food and dogs, I think, are the key elements here. Sometimes kids won't even come to see me when the parents talk to them. And so the parents come in for their initial consult. They take a picture of Cody, and then they bring the picture home and they show their kid. Oh yeah, I'll go see Dr. Steve. Is Cody going to be with us? Yeah, okay. So, yeah. I mean, I know it sounds simplistic, but you got to get them in the door. So pizza and dogs and discussion series on things like how to convince your parents to give you more screen time, something like that. That might do it.
Well, food and dogs definitely sound like my kind of party. So let me know when's the next one. I'll definitely come visit. To follow up with that question, how can we, the Peaches and Cream Foundation, assist you with your mission? You have like the Dadditude App, these coaching cards, your books. Like, how can we help you get that out there? Just get more people.
Keep in mind that the Dadditude App is nothing that I really have direct control over. It's really owned by this gentleman, Paul Barone, who was actually a Frenchman who was in Germany at the time. And I believe he's actually trying to sell the app currently. He's not, I don't believe, continuing to add more content because he's, I think, lost the time and the energy to keep developing it, but it's still out there. It's really my coaching cards that I'm still attempting to attract attention. And depending upon how the three of you want to devote your time, I could envision that you could conceivably start using these cards in running groups of your own. Though I know that most of what you do is virtual at Peaches and Cream, so I'm not sure how you would do that unless you have connections with folks that are really on the ground and in community mental health centers or in different community agencies and want to consider using the cards and running groups. That's available.
And then to shift over to people like us, what advice would you give psychology students and interns?
Go and get experience. And I don't mean virtual experience. I mean, what you're doing, obviously here is very worthwhile. But I think you really need to have face-to-face contact, with folks that are struggling with their mental health. I think that's harder to do in today's world than it was in 1980 when I went to Chestnut Lodge and got my first experience in the field. But, there's pathways that you can pursue. And if you're interested in working with children, then I'm sure there's summer camps that you could apply to. And these aren't necessarily internship types environments. When I worked at Chestnut Lodge, that was not an internship. That was a full paying job. But it paid in many ways, for me to get it because it landed me in the field. So yeah, I would try to, just put yourself among the population that needs you.
In closing, are there any main takeaways from this conversation or anything you would like to say to the listeners?
Well, to help people with social problems, it's really important to understand what level they're having trouble and the social disabilities and how they might relate to their own learning style or learning disabilities. The immaturity of many children with learning differences transcends the academic area. and it really puts them at risk for poor outcomes, in their adult future. So in my mind, we really need to stress more than the 3 R's. We need to add a 4th R, relationships, in growing our children in today's world.
Well, thank you so much, Dr. Richfield, for sharing your valuable insights and experiences with us today as a clinical psychologist. It's been a very enlightening conversation, and we're extremely grateful for your time and contribution.
Well, thank you for having me. Feel free to reach out if I can be of any further assistance.
Of course, we hope our listeners enjoyed today's episode and found it as inspiring as we did. Remember, guys, mental wellness is a journey, and it's essential to support each other along the way.
We also want to extend our gratitude to all of our listeners, supporters, and everyone else involved with the Peaches and Cream Foundation. Your support enables us to continue our mission and make a difference in the lives of children and young adults.
If you would like to learn more about the Peaches and Cream Foundation, get involved, or support our cause, please visit our website at www.peachesandcream.org. That's www.peachesandcream.org. Thank you, everyone, for tuning in to the Peaches and Cream Foundation podcast. Your support is invaluable, and we look forward to bringing you more inspiring stories and conversations. Don't forget to visit www.peachesandcream.org for more information and to support our mission. Thanks again, and see you next time.
So long, folks.